Right, on average, one baby dies every other week in our community due to unsafe sleep practices. These deaths are preventable and come from not knowing perhaps the ABCs of safe sleep. So let's get a reminder. In this segment sponsored by Franklin County Children's Services, I'm happy to welcome Maureen Stapleton with Celebrate One, and we also have Catherine Chiraldi with FCCS. So ladies, thank you for being here.
Thank you.
Thank you.
All right, Maureen, this is unfortunately a real problem in Ohio. It's a real problem here in Columbus. So first, shed some light on the mission of Celebrate One for us.
Celebrate One was created in 2014 as a recommendation that came out of the Greater Infant Mortality Task Force, which was to create a backbone agency or coordinating agency to work on infant mortality and the disparities that exist between Black and brown babies. And so out of that task force, Celebrate One was born, and we've been at it for 8 years now, including the time that the task force met to come up with its initial recommendations.
And these initial recommendations, I feel like people are familiar with them by now, but not enough apparently, because it's still a problem. So run us through the ABCs of safe sleep.
So one of the targets and one of the programs that we knew had to be addressed here was how to properly put a baby to sleep. Sleep-related deaths continue to be an issue, and unfortunately in 2022, this year, we've seen a rise. And so the ABCs of safe sleep are very simple. A baby should always be alone in a crib, on their back, and in a safe sleep environment. And I said crib, but it really means a safe sleep environment. That could be a pack and play or a crib, alone, on their back, and in a safe sleep environment like a crib.
And these aren't just things that you follow when you're not tired, that you follow when you remember. And I think that's important because as, you know, a mom, you get to the point where you're just trying to get a piece of rest yourself.
That's right.
And sometimes you kind of let those go by the wayside, and that's obviously not safe.
Right, it's not safe. And so what we try to teach with our ambassador and ally training is have a sleep plan for your baby at all times. Okay. And those who are watching your children, the aunts, the grandparents, the friends, the extended family, all need to be trained properly on the ABCs of safe sleep.
Okay, we just saw a graphic pop up, Catherine. This is actually a billboard that Celebrate One and FCCS is placing around Columbus. So this is one of the ways, obviously, that you're trying to get this message out. But Catherine, tell us how it is you reach people and how it is that you're constantly trying to get this message to families you serve and really beyond.
Sure. The billboards is just really part of the campaign to make it a public awareness. But on an individual basis, our caseworkers work with families, and it really is about meeting with families and talking through how to keep their children safe. It's a conversation, it's a collaboration between child welfare and the families that we serve. And regarding safe sleep in particular, our caseworkers are trained to go out, meet with families, talk with them about the ABCs of safe sleep, and ensure that families have a safe sleep surface.
And I understand that you're actually called to the hospital pretty often because something went wrong at home, even if you've never seen this family before. So it's not as if these are all families on your radar or families you've had some kind of relationship before with.
Yes, that's correct. We are often called to area hospitals to work with families that we don't have any prior involvement with or current involvement with. And sometimes that's due to concerns for abuse or neglect, but oftentimes it's due to concerns for lack of resources or lack of services. And what can we do to help those families get those resources and services? And when we do meet with families at the hospital, and in particular, new families with new babies, we still have that conversation and that education about the ABCs of safe sleep, and then we also ensure that the family has a safe sleep surface for when the baby returns from the hospital.
Okay, and Maureen, I know that you mentioned grandparents, caregivers. This is a group effort, and it's not just that they have this safe sleeping environment. I know a lot of prenatal care. There are a number of things. So we want to get resources into people's hands. Tell us how you guys do that.
We do that through our Community Connector Core though they are community health workers who go and actively find pregnant and parenting families to work with and to provide services with. And here we're lucky in Franklin County that every baby who leaves the hospital in the winter months leaves with a sleep sack. They all have to watch a video on how to put a baby down correctly. And they have a little door hanger that they can put on their nursery door as a reminder of the ABCs of safe sleep. But ultimately, there are all sorts of services that a community health worker from Celebrate One can provide. And so we connect people to resources like transportation, food assistance, housing, and a variety of other partners help us get those things accomplished. We also work with folks to provide perinatal care and training to moms and dads to be better parents.
Yeah, the information is out there, so go seek it or it will find you.
That's correct.
To give you that information.
That's
of
correct.
course, Celebrate One and FCCS doing amazing things to help our babies. So thank you guys for being here.
Thank
Thank
you.
you.